Hello, hello, hello. Good afternoon, everybody. I am here to say hi. I'm continuing my live videos for the month of January. This week, I am talking about 4 steps to feel better. Today is move your body every day. Before I get started into this, I want to remind you guys, I am going live again later today, not in the Facebook group. This is on Zoom with a separate link to sign up. I'm going live in less than an hour, 45 minutes from now, to talk about why you're in pain, what's getting in your way, and what to do about it now. So that we'll talk about what is still causing your pain, things that are getting in your way, and then the step-by-step process of what to do next. Okay, so it's 1 p.m. Pacific today, Tuesday, January 11th, that I'm doing that. So please, please, please join me. The link is in the Facebook group to join. If you don't see the link and you want to join, comment on this post and I will send you the link. Okay, so today I am talking about 4 steps to feeling better. Move your body every day. So what do I mean by that? Many of the people that eventually come into my world tell me, well, my doctor told me just walk 30 minutes a day. And that was what I needed to do to fix whatever kind of pain or problem I have. That doesn't really work. Most people can't start off walking 30 minutes a day. So we're setting everybody up for failure by giving that advice. I hate that advice. I don't advise it myself. And I don't think it's realistic for people to be able to start off doing that. Do I think it's realistic for people to be able to eventually get there? Yes, you eventually can get to walking for 30 minutes every day. But that's not the starting point. That's the end goal. The end goal, based on the ACSM guidelines, is do moderate exercise for 150 minutes a week. It's 30 minutes, 5 days a week. You can do that, right? We can eventually do that. Maybe you can't do it right now. So what kinds of movements do I recommend? What do you like to do? How do you like to move your body? And that's how you should move your body. That's the best recommendation. I recommend people move every single day, do some kind of purposeful movement as an exercise. You know, don't just say, oh, well, I went to the grocery store today, so that's walking. No, that doesn't count. That's not purposeful exercise unless you did something like mall walking, where you literally went to the mall, not to shop, but you went to the mall with the purpose of walking. So having purposeful movement is different than everyday movement, because your mind is focused on the activity that you're doing if it's just your daily activity. So if you're going to the grocery store, you're not focusing on how you're walking, how fast you're walking, how your heart rate feels, and overall how your body feels. You're thinking about what's on my list. I need to get chicken. I need to get eggs. I need to get some spinach. I need to get this. I need to get that. You're not thinking about the walking. If you're going to the mall to go shopping, you're thinking about, okay, well, where is Macy's and where is Nordstrom and where is whatever other store you're shopping at. If you're going to the mall for mall walking, which is a specific activity, you are now thinking about your body, your movement, you're thinking about your steps, you're thinking about your heart rate, you're thinking about how you feel. So it's different than just your day-to-day activity. So when I talk about moving your body every day, yes, of course, you need to do your day-to-day activity. And if you're like seriously ill, like you have a fever, you are, overcoming an illness, you're on antibiotics, something like that. Well, yeah, maybe just doing your daily activities are all you can do that day. That's also not what I'm talking about. I'm talking about on the days that you're feeling yourself, move your body a little bit every day. So that could be walking. If you can only walk for 5 minutes, well, walk 2.5 minutes down the driveway and down the street and 2.5 minutes back. Great, you're done. Do that for as many days in a row as you can. and add another 30 seconds when you can. Okay, so that's walking. You can also swim. You can, if you can only swim for 5 minutes, great, go swim for 5 minutes. And over time, add another minute, add another 5 minutes, add what you can to build up to that 30 minutes. You can also ride a bike, stationary or not stationary, especially if you have a lot of back pain, knee pain, hip pain when you're walking. Swimming or riding a bike are great alternatives. They work the muscles, they work the body, they pump the blood, they work the heart. They're just not as taxing as walking is. So those are examples of some cardiovascular activities that you can do for movement: walking, swimming, riding a bike. You can also walk in the water if you don't have a bike and don't really want to swim, but you have access to a pool or deep water. You can walk in the water. And then you also want to do some strengthening exercises. So oftentimes we forget about strength and we end up doing more cardio and stretching because we feel like that's what we need. Well, in order to get stronger, you need to do something to make yourself stronger. So lifting weights, body weight movement with repetitions. So you guys have seen me do exercises like clamshells, lying leg lifts, like lying on my back, lifting my leg, lying on my side, lifting my leg. Those are strength exercises with no weights. You can do them sitting, standing, laying on your back, belly, or side, hands and knees position. You can do them leaning against the counter. There are many different ways. So you want to strengthen your body as well. So make it so that those muscles get tired, but it doesn't create pain in your joints. Your muscles will fatigue, they'll feel a little sore, and then you stretch. You hold the stretch for 15 to 30 seconds. Overall time of holding a stretch should be 60 seconds. So if you're doing 15 seconds at a time, you need to do that 4 times. If you're doing 30 seconds at a time, you need to do that twice. If you can only hold it 10 seconds at a time, then you do 6 times. But the overall hold of that stretch is 60 seconds. Okay, so today's was short and sweet. Move your body every day. The best thing to do is find a way to move your body that you like to do and is relatively comfortable to do. It's not, it's always going to be challenging. It should be challenging on your body. It should not be significantly painful, and it does not have to be significantly painful. So you can walk, you can swim, you can ride a bike, you can use an elliptical, you can do an exercise class, yoga, Pilates, chair yoga, Tai Chi. And then you also want to strengthen your body where you're either lifting weights or you're doing body weight movements for repetition. And then ending with stretching where you hold a total of 60 seconds at a time per body part that you're stretching. So that was an overall all-encompassing kind of way to move your body. If you're looking for other examples of how to exercise, how to strengthen your muscles, how to stretch your muscles, look for the posts in the post topics with #strength, #morning stretches. My Monday movement pieces have some exercises in them. And as always, ask me questions. I'm happy to answer them, either in format like this, where I do a live on Facebook, or in a one-on-one call that's free if the question is just very more specific to your case. So I will talk to you guys soon. Enjoy the rest of your day. And I hope to see you in just over half an hour where I go live on that Zoom link.